Hello and welcome to another edition of Health in the Heartland, a program dedicated to the health issues that affect you, your family, and our community. Joining me this episode is Michelle Murphy, Director of Marketing and Public Relations at Hardin Memorial Health. Thanks for being here, Michelle.
I'm glad to be here this morning.
We are going to talk about some great things that are happening with Hardin Memorial Hospital, now Hardin Memorial Health. And let's start a little bit talking about the transition from Hardin Memorial Hospital to the term Hardin Memorial Health.
Yeah, this is an exciting time for our organization because since 1954, Hardin Memorial Hospital has been in existence. But last year, we really made the decision to formally transition our name to being more than just a hospital to Hardin Memorial Health. And really the thought process behind changing our name and more of a way of thinking was really brought about through BRAC. When we started working on trying to communicate to all of the people who were going to be coming to our community what we really were, what we offered, we recognized that many of those people were used to hospital systems from big metropolitan areas. And as we were adding service locations at that time, we kept putting a Hardin Memorial Hospital logo next to their name. And what we found is we had a lot of confusion in the community because people would refer to that as Hardin Memorial Hospital or that location tied to that. And people would assume that that was 913 North Dixie. So oftentimes, whether it was our Bardstown Diagnostic Center or Brandenburg Diagnostic Center or our Care First location, people who were not familiar with our community and all of our roads would assume that they needed to come to 913 North Dixie. And so it was really through that thought process that we came up with the term of Hardin Memorial Health. And it really does embody what we do as an organization. Here in the community, we are there to take care of our community's health. And so it's very fitting that we chose that name.
Absolutely, and I think you brought up a couple of great points because it's not just the building anymore, 913 North Dixie. We have many locations, not only in the Hardin County area, but in a lot of surrounding counties. Tell us a little bit more about those other counties and what those locations actually are.
Sure, we have been growing over the past year, and it's been really exciting. We have now 17 physician locations. That means that we have employed physicians in 4 different counties offering services close to people's homes. On top of that, we have 15 locations of outpatient services located in Nelson County, in Meade County, and throughout Hardin County. And that really takes our hospital, all the services that we offer, and pushes those out further into the community, especially with gas prices the way that they are. People don't have to travel as far to that main hospital, find a parking place, navigate their way through our halls, and then consume those outpatient services.
I think that's very important because you want care close to home. But the other thing is we also have the continuity of care now being a system, even though we have those outlying areas that we're all working together as a system to take care of the patient and provide great quality of care.
Definitely, especially with the use of technology now and electronic medical records. All of our locations are technically connected. So that means if you have an x-ray at our Bardstown Diagnostic Center and you happen to come to the hospital for surgery or something, or even end up in the ER, they can pull your medical record up in the computer, see exactly what that x-ray was about. Or if you were at a Care First visit and say you had a test there or something and you ended up back as an inpatient or in our emergency department, the doctors there can pull up your exact medical record and see everything that's happened to you. So it really does make that continuum of care very, very good for our organization and for the outcome of that patient.
Excellent. Now we've talked a little bit about the hospital and we know the services that a hospital provides. What are some of the other services? I know you said diagnostic services. We also have a lot of other physicians that have some specialties that have come on board. So tell us a little bit more about those.
Recently we had Dr. Cole join Dr. Thad Jackson, and he's our newest neurosurgeon. Came out of the U.S. military down to us and was really great friends with Dr. Jackson and be able to provide really great neurosurgery, a service line that we acknowledged we needed to bring on board because people were traveling to Louisville or Nashville for this service. So by having that specific service line and 2 providers that now provide that deliver great quality care, we're able to keep patients close to home. We've recently added Dr. Reynolds. He's pain management, and this is a service line that we've not had here before, but we do acknowledge that people were traveling long distances for that. We've beefed up our family practice. We've hired so many new, wonderful, good quality family practitioners who is really serving servicing that need in our community. It's really exciting to watch all the high quality specialists that are coming on board with us that are providing the level of care that I think healthcare consumers demand at this point, and also that we're able to keep those patients close to home so that their family members can come visit them or they can be close to rehab.
Absolutely. Now we also have urology, ear, nose, and throat, right? ENT. We have lots of specialties that are encompassed under the Hardin Memorial Health, correct?
Yes, definitely. And we just added a new service line, urogynecology, which is a new service line that I don't think much of the community is very informed about. And it kind of takes urology and gynecology and puts it together. So if women are having issues with their pelvic floor or various different urological conditions, urogynecology specialist is now here in the community. And that's Dr. Susan Tate, who joined Dr. Schoaf.
Excellent. So we've got a lot of services, a lot of resources really provided right here in our community and servicing the outlying areas too. I know you've got a shirt on there that says Art of Caring, and the hospital has also taken on a new vision and value statement. Tell us a little bit about that.
Yeah, our new mission is really to take care of the spiritual, physical, and emotional needs of patients, family members, our physicians, and our staff. And really under that mission, we are there to provide the best possible quality care, whatever that care is that that patient or family member, staff member, or physician requires. And yes, the shared art of caring, we at Hardin Memorial Health are taking on a new way of thinking about what we do, a new culture, and really art of caring kind of embodies that. We understand that many artists or painters or various different things, they perfect their craft. Well, the same thing with us at the hospital. We have a craft. People go to school for many, many years to work on what might be the best art form, and that's the human body. And so as you walk through the halls, and if you've been to our main campus at 913 North Dixie, you've probably recognized a little bit of the renovation. And we recognize that we need to improve upon our facilities, and that's actually one of the goals of our strategic plan. But you'll see artwork featured up in the hallways, and it's just been really a great project to work on, since local photographers have submitted their beautiful photography of our local community that we then had applied to canvas, and now is more of like an art gallery when you walk through our main areas of the hospital.
You know, bottom line is this is really the foundation of wellness and taking care of people, and that's really what we're striving for at Hardin Memorial Health, and making sure that we're giving the best to the patients that is out there in their continuity of care, and also in helping meet their needs and looking at satisfaction scores and giving them what they need here in our community. Tell us a little bit about some of the satisfaction scores and how we are taking this into account and how we can take care of our patients.
Yeah, wellness definitely is a focus for any healthcare organization, especially with healthcare reform, because the federal government is incentivizing all organizations across to provide better quality care at lower cost. And a lot of that is taking care of our communities and making sure that wellness is more the focus, where most of the time the healthcare industry has been based on a sick model. Now I think you start to see this transition into a well model, where I know your staff is out a lot at various community festivals and with the mobile health unit offering those screenings, and screenings are so very important to be able to find disease processes a lot sooner. And through research and through the standards of care, if you're able to find disease processes a lot earlier, then it's actually the outcomes are better and it's lower cost. And that comes back to healthcare reform with surveys. Essentially, most patients who are seen as an inpatient through our emergency department, has surgery, or at one of our outpatient locations, gets a survey. And the federal government says that we have to survey our patients. And it's so very important for when patients receive that survey at home to answer those questions and tell us where we can improve or what we're doing really great. Those surveys, then the government takes a look at and decides based on the measures, how many 4s or 5s we may score on that, what the money that we're already supposed to get to be reimbursed, how much of that we get. And that's actually called value-based purchasing. And that's probably a term that the community is going to hear more and more about as healthcare reform and the legislation from the previous act that is being put into place starts to heat up again this coming summer.
Now, when we talk about costs, that's the cost for the patient, the hospital, all medical costs in general, correct?
Definitely. And if you think about the bigger picture, if you have people really focusing on wellness, then these disease disease process don't get prolonged, and then we're not having to invest a lot of our own personal dollars or our company's dollars or the medical dollars out there in longer term treatments or in more diagnostic tests and various different things. And I think that's really where the federal government is going and trying to bring that cost back to the wellness model.
Absolutely, and really striving to have individuals take personal responsibility for their own health and partnering with their healthcare physician on how they can better their quality of life.
Definitely, and from the very get-go, I guess that's why, I know I've heard you talk at many times, the importance of having a healthcare provider, someone who takes care of you. And oftentimes some people think that that might just be a physician, but there are so many provider extenders out there with nurse practitioners and physician assistants and of course our medical staff that can provide great family care. And by having that relationship with that healthcare provider, having those annual screenings, having those annual physicals, that is so important so you can actually track where your numbers are.